Good morning, and thank you for joining our weekly COVID-19 briefing. As always, we're joined by Acting Health Commissioner Dr. Cheryl Bedegal. Today's briefing is being live streamed on the Health Department's YouTube channel and will be available for future viewings there. Today's briefing will run until 10:30. As usual, we will present remarks first in English, then in Spanish, then open it up to questions from the press. We ask that media outlets coordinate internally to ensure that only one representative asks questions and that we limit questions to 2 or fewer. Please keep your questions focused on the topic of the COVID pandemic and the city's response to it. With those instructions out of the way, Dr. Bedegal, will you please kick us off?
Sure. Good morning, everyone, and welcome to our weekly briefing. As usual, we'll start off with an update to the numbers. First, since last week, 1,395 more Philadelphians have been diagnosed with COVID. As of yesterday, we're seeing an average of 255 new cases per day, which is approximately where we've been since early September. Since Labor Day, the average new cases per day has bounced around in between 230 and 280. We're now averaging more than 7,000 tests per day in Philadelphia. And just as a point of reference, that's around 0.5% of Philadelphians being tested every day, some days as high as 1%. Fewer than 3% of the test results we're receiving are positive. That confirms what the Inquirer has been reporting, that Philadelphia has had the lowest per capita level of COVID in southeastern PA since early September. In terms of vaccines, we're quickly approaching 2.1 million doses administered. Nearly 1.1 million Philadelphians have received at least one dose, which means that more than 80% of all people who are eligible and 86.6% of adults have gotten at least one dose. More than 880,000 Philadelphians are fully vaccinated, which means that nearly 66% of all people who are eligible and 70.9% of adults are fully vaccinated. In terms of equity, we continue to see progress on narrowing the disparity in vaccination for adults under age 45 and to see vaccine equity among those 45 and over. And boosters continue to be administered throughout the city. As I reported last time we talked, about 8,000 of the doses administered last week were booster doses, meaning that more than 32,000 boosters total have been given out. Booster doses are important because they help prevent breakthrough cases, particularly among those who are over age 65 or have either underlying medical conditions or high-risk occupations. I also wanted to follow up on last week's discussion about vaccine mandates. As you know, Philadelphia's vaccine mandate for healthcare workers at long-term care facilities and hospitals, and the mandate for colleges and universities took effect last Friday. I am deeply grateful to the many people who stepped up and got their vaccinations to meet that deadline. We're still waiting on the final data from the last few days before the mandate took effect, and for the results of the survey that went out to long-term care facilities. But so far, the data look very encouraging, including a steep increase in the vaccination rate for long-term care workers to at least 90%, even without the final days of data. The remaining healthcare workers must be vaccinated by this Friday, October 22nd. That means that all remaining healthcare workers must either have had at least one dose of COVID-19 vaccine or have a medical or religious exemption by this Friday. There are vaccine sites all over the city that would be happy to provide doses to those workers. Remember that there is no philosophical exemption for these vaccine mandates. Testing is only an alternative option for those who have religious or medical exemptions. Now, as we start to feel the fall chill in the air and know that people will soon be spending more time inside, we have a clear choice in front of us. We can do everything possible to avoid another fall and winter surge in COVID cases, hospitalizations, and deaths. Or we can choose to protect ourselves, our families, and each other. For those of you who are still unvaccinated, that means stepping up and getting your shots. For those who are vaccinated, it means remembering that we aren't out of the woods yet. So remember to mask up if you have to be in a crowded indoor space, to gather outside rather than inside when you have a choice, and to get your booster if you fall into one of the recommended groups. To wrap up, if you'd like more information about the pandemic and the city's response, You can visit our website at phila.gov/COVID. If you have questions, please call our COVID call center at 215-685-5488. Now I'll turn it over to Zelly to present these remarks in Spanish. Thank you.
Buenos días y bienvenidos a nuestra sesión informativa semanal. Como de costumbre, comenzaremos con una actualización de los números. Primero, desde la semana pasada, 1,395 habitantes más de Filadelfia han sido diagnosticados con COVID. Hasta ayer, estamos viendo un promedio de 255 nuevos casos por día, que es aproximadamente donde hemos estado desde el principio de septiembre. Desde Labor Day, el promedio de nuevos casos por día ha rebotado entre 280 y 230. Ahora estamos promediando más de 7,000 pruebas por día en Filadelfia. Menos del 3% de los resultados de las pruebas que estamos recibiendo son positivas. Eso confirma lo que el Inquirer ha estado informando, que Filadelfia ha tenido el nivel per cápita más bajo de COVID en el sureste de Pensilvania desde principios de septiembre. En cuanto a las vacunas, nos acercamos rápidamente a los 2.1 millones de dosis administradas. Casi 1.1 millones de habitantes de Filadelfia han recibido al menos una dosis, lo que significa que más del 80% de todas las personas que son elegibles y el 86.6% de los adultos han recibido al menos una dosis. Más de 880,000 habitantes de Filadelfia están completamente vacunados, lo que significa que casi el 66% de todas las personas que son elegibles y el 70.9% de los adultos están completamente vacunados. En términos de equidad, seguimos viendo avances en la reducción de la disparidad en la vacunación para adultos menores de 46 años y en ver equidad en la vacuna entre los mayores de 45 años. Y los refuerzos continúan administrándose en toda la ciudad. Como informé la última vez que hablamos, alrededor de 8,000 de las dosis administradas de la semana pasada fueron dosis de refuerzo, lo que significa que se han administrado más de 32,000 refuerzos en total. Las dosis de refuerzo son importantes porque ayudan a prevenir casos innovadores, particularmente entre aquellos que tienen más de 65 años o tienen afecciones médicas subyacentes o ocupaciones de alto riesgo. También quería dar seguimiento a la discusión de la semana pasada sobre los mandatos de la vacunación. Como saben, el mandato de vacunación de Filadelfia para los trabajadores de la salud en centros de atención a largo plazo y hospitales y el mandato para colegios y universidades entró en vigencia el viernes pasado. Estoy profundamente agradecida por las muchas personas que dieron un paso adelante y recibieron sus vacunas para cumplir con esa fecha de límite. Todavía estamos esperando los datos finales de los últimos días antes de que el mandato entrara en vigor y los resultados de la encuesta que salió a los centros de atención a largo plazo, pero hasta ahora los datos parecen muy alentadores, incluido un fuerte aumento en la tasa de vacunación para los trabajadores de atención a largo plazo a al menos del 90%, incluso sin los últimos días de datos. El resto de los trabajadores sanitarios deberán estar vacunados antes de este viernes, el 22 de octubre. Eso significa que todos los trabajadores de salud restantes deben haber tenido al menos una dosis de la vacuna COVID o tener una exención médica o religiosa para este viernes. Hay sitios de vacunación en toda la ciudad que estarían encantados de proporcionar dosis a estos trabajadores. Recuerde que no existe una exención filosófica para estos mandatos de vacunación. Las pruebas son solo una opción alternativa para aquellos que con exenciones religiosas o médicas. A medida que comenzamos a sentir el frío del otoño en el aire y sabemos que la gente pronto pasará más tiempo adentro, tenemos una opción clara frente a nosotros. Podemos hacer todo lo posible para evitar otro aumento de otoño e invierno en casos de COVID, hospitalizaciones y muertes. O podemos elegir protegernos a nosotros mismos, a nuestras familias y a los demás. Para aquellos que aún no están vacunados, eso significa dar un paso adelante y recibir sus vacunas. Para aquellos que están vacunados, significa recordar que aún no estamos fuera de peligro. Así que recuerde enmascararse si tiene que estar en espacios interiores abarrotados, reunirse afuera en lugar de adentro cuando tenga una opción y obtener su refuerzo si cae en uno de los grupos recomendados. Para concluir, si desea obtener más información sobre la pandemia y la respuesta de la ciudad, puede visitar nuestro sitio web en phila.gov/COVID. Si tiene preguntas, llame a nuestro centro de llamadas COVID al 215-685-5488. Thank you. Gracias.
Thank you very much, Zelly. We'll now move to the question and answer portion of our program. If you have a question, please use the raise your hand function and we'll take those questions in the order received. Given that we're running a little bit ahead of schedule, we'll let reporters ask up to 3 questions, though we still ask that you stick with the topic at hand. If there are any reporters who do not get the opportunity to ask questions, please follow up with us by email and we'll get you an answer. First up, we'll go to Trish Hartman from Channel 6. Go ahead, Trish.
Hi, thank you. Questions, is there an update on the number or percentage of city employees who are vaccinated? And we're curious, after New York City just announced today a vaccine mandate for all of its workers, and that mandate would involve unpaid leave for those workers who do not comply, has the city considered anything like this? Also, can you clarify, I believe Dr. Bedegal mentioned on the long-term care employees, you mentioned something about having to have at least 1 dose by this Friday. And I was a little confused by that because I thought it was last Friday, but maybe I misunderstood. So if you could clarify that one point, I would appreciate it. Thank you.
Sure. So long-term care workers were required to have 1 dose by this past Friday, as were hospital-based healthcare workers. All other healthcare workers are required to have 1 dose by this coming Friday. In terms of city workers, so we don't have the type of vaccine mandate that New York has. So it's not a vaccine or be terminated mandate. It's a requirement to either be vaccinated or to double mask. And, I think because the consequences are that anybody who hasn't submitted their proof of vaccination has to double mask, we haven't necessarily seen terrific uptake in terms of people submitting those results. That result means that many city staff do need to double mask in the office. I think people may be comfortable with that at this stage.
Any more, Trish? You should be able to unmute. Oh, sorry, I accidentally muted you again. Try.
Sorry, hi. Do you have a percentage of those who have reported their vaccination status?
I believe it's still in the 32-33% range. We know that many more city workers than that were vaccinated, but in terms of people who have uploaded their proof to the city's One Philly system, it's still quite low.
Okay. And is there any concern about hospital workers or a shortage of healthcare workers because of the vaccine deadline and from what data you've seen so far?
So from the hospitals, what we're hearing is that their vaccination rates have climbed really well and that they're quite high. So I haven't heard concerns about being shorthanded, other than the baseline concerns that we've heard all over the country of the shortage of nurses, healthcare providers who are burned out from everything they've had to do during the pandemic. But specific to our vaccine mandate, they seem to be doing very well.
Any more, Trish?
No, that's it. Thank you.
Thank you very much. Next up, we'll go to Laura McChrystal from the Inquirer. Go ahead, Laura.
Hi. Following up on those last questions, Dr. Bedigel, would the city consider something like New York, which, they just announced there's no out, everyone has to get vaccinated for city workers? Is something like that still on the table down the line?
So that isn't something that we are currently discussing. With all of these mandates, it depends where we are with the pandemic. So currently in Philadelphia, I wouldn't say things are good because we're still at high transmission. We still have significant numbers of people in the hospital, but we aren't seeing a surge in cases. Now, I will say that in other places that are a little bit colder, we are seeing cases go up as the weather gets colder, as people start to gather indoors. So that's why I want people to be really, really thinking, I'm hearing from a lot of people around the city that they're seeing people in big gatherings indoors unmasked. And if we start doing that kind of thing, we will see a surge in cases. So if we can keep a lid on this, then we don't have to have more mandates than we currently have, but it just depends where we go.
Okay, and can I, ask just, I guess, more specifically, could you sort of explain why you're not considering a mandate like New York's for city workers?
So, in general, the decisions about mandates and other kinds of restrictions are driven by the science. So the mandates that we have that are very strict are for places where people are highly vulnerable. In other words, long-term care, hospital, other kinds of healthcare settings, or where we're seeing high levels of spread. And that's the reason for the mandate for colleges and universities. We were seeing very high levels of spread, particularly among young adults. And we know, historically through the pandemic that, kids living together on college campuses can very easily spread this virus. And once we have more virus circulating in the community, then it spreads to everyone. It can spread to elderly people, people with medical conditions. So those two groups, highly vulnerable spots and groups with high transmission rates. City workers who are not healthcare workers don't necessarily fall into either of those groups, but we do want to be setting a good example for the city. And we do want to, protect other city workers who are coming back into the office. So that's the reason for the double masking for people who are not vaccinated. That doesn't mean we wouldn't move to something stricter, if conditions get worse. But in terms of where we are now, that's the reasoning.
Okay. And you mentioned that, you're hearing reports of people seeing large groups gathered indoors, unmasked. Could you comment overall on how the mask mandate is going right now? And, when you hear reports of instances like that, are those things that the city can send someone to respond to and enforce?
So I would say that overall, those are the exception. And I'm talking about private gatherings. So they don't necessarily violate any particular city rule. They're just a bad idea. But in terms of what people are doing in public spaces, masking had been very high in Philadelphia. We were the highest big city in terms of masking earlier in the pandemic. When we got rid of our mask mandate, people, and case rates were low, people stopped wearing their masks. And then what we've seen since the mandate was passed is a very sharp uptake that has now stabilized at a high rate of people wearing their masks and wearing their masks correctly in public indoor spaces. So Philadelphians really are stepping up. I hear from everybody who saw somebody not wearing a mask correctly. I know it's happening. I know it is imperfect. But overall, there's been a very sharp increase in the number of people who are wearing their masks in indoor public spaces in Philly. And as far as I can tell, the timing of that fit perfectly with when our surge in cases stopped and really leveled off. It's a contrast to other places that don't have mask mandates and are seeing higher case rates. So, the masks really do make a difference. We have lots of science to show that. And what we're seeing here in Philadelphia is consistent with that.
Okay, thanks.
Thank you very much, Laura. Next up, we're going to go to Pat Loeb from KYW. Go ahead, Pat.
Dr. Bedigel, despite the increase in vaccinations, the number of new cases is continuing to hover around 250 or so. Do you have any theories about why the case rates are not going down?
Sure. And I think the vaccines are really responsible for them not going up. We have a couple of things happening. We have kids back in school. And our worry had been that when kids went back to school, we would really see a large surge. That really hasn't happened, although our highest case rates right now are in people under the age of 20. But kids in school definitely is a potential driver. And then as it starts to get colder, there's again risk of people starting to gather more inside. So I think those forces are pushing cases up, but the vaccines are pushing cases down. And I think that's why we have been in this steady state. Hopefully, as vaccination rates continue to rise, we'll be able to get down out of the 200s.
And do you have any data on how the vaccine mandate is working on college campuses? Is the rate of spread slowing?
So the vaccine mandate for college campuses also just kicked in last Friday. I'm not aware of any large clusters on college campuses right now. So, that's good news. And the higher rate of cases in people 20 to 34 has come down. So both of those things are encouraging. It's hard to know. A lot of colleges and universities had already gone to a vaccine mandate themselves. So I think that's been very, very helpful.
Okay, thank you.
Thank you very much, Pat. Laura, it looks like Laura McChrystal from the Inquirer has another question. Laura, we'll turn it over to you.
Hi, just one more question because I didn't see anyone else's hand up. Dr. Bedigal, on the booster doses, I know you've been giving us the numbers of how many people are getting them. Does the city have a sense of how many people are eligible for them? Like in terms of being able to figure out what the uptake is, what percentage of eligible people might be going to get them versus not?
Right. So the denominator, right, the number of people eligible changes day by day because it's 6 months from completion of the dose. So our initial group was about 61,000, but of course that's gone up since then. So we are now starting to get into the time when we're 6 months out from the FEMA clinic. And that means that it's going up a lot every day. Uptake's low, and it's low everywhere. We're hearing this from our colleagues in other health departments. We are, we've gone from the planning stage of this when we were planning for what do we do if we have a lot of people who want their boosters in that first couple of days to knowing we have to encourage people. And we've started putting out text messages and robocalls to people who are eligible for those boosters, just to remind them, hey, you're due, you could get that shot. And I think it's going to be a lot more work in the weeks and months that come to particularly focus on the highest risk people and make sure that they get those booster shots.
Okay. And are you concerned as we head into the winter months that there is a low uptake? Is that putting people at risk?
So, overall, the vaccine efficacy really does remain pretty strong. That's more true for Moderna than it is for Pfizer. And I think we're going to see the booster recommendation for J&J come out very soon. And I think there are a lot of people who are waiting for that recommendation. For Pfizer, there is a little bit of decay in efficacy as far as we can tell, or Delta is just that much more aggressive. And we would like to reach those people. It's primarily the people who are 65 and over who are at higher risk. And there seems to be an increase in hospitalizations, in breakthrough hospitalizations among Black city residents who are over the age of 45. So, that's really the folks we're going to be most concerned about getting boosted. Boosters for younger adults, there's much less evidence in support of a need to do that. So we're going to focus on the people at highest risk.
Okay, thanks.
Thank you very much, Laura. Looks like Trish Hartman from Channel 6 has another question. Go ahead, Trish.
Hi, thank you. This morning, the Biden administration rolled out a plan in anticipation of children's vaccines being authorized by the FDA and then the CDC. Anything to report in terms of the rollout in pediatric vaccines in the city? Are there any planning steps underway that you can tell us about as to how distribution will work if and when those shots are approved?
Sure. Yes, I think a lot of people are really excited for this. We're anticipating, if things go well, probably approval in the first week of November, maybe the second or third, which would allow us to potentially start vaccines for kids 5 to 11 as soon as November 4th. Our understanding is that we will get initial orders of vaccine, which we can pre-position with kind of high impact providers who are able to do a lot of vaccinations and to do them to reach populations at highest risk. There are vaccines for children enrolled providers in Philadelphia who normally give pediatric vaccines. We're up to now 70% of those vaccines for children providers who are enrolled as COVID vaccine providers. And that makes them, good candidates to give this vaccine out, as well as, of course, the hospital partners, the federally qualified health centers, and the pharmacies. So there'll be lots of different places to get this vaccine. Our understanding is that there will be enough vaccine for 5 to 11-year-olds. Similar to boosters, if you try to get vaccine on day one and you struggle, you'll probably be able to get it in a few days or a week. So don't panic. There does seem to be an adequate supply of vaccine. It'll take a little while for it to arrive in Philadelphia, but we will have some doses. But my understanding is we'll have some doses pre-positioned in the city.
Thank you.
Thank you very much, Trish. Seeing no more hands raised, I'm going to call a lid on today. Thank you all again for joining us. This will conclude today's press briefing, and we will announce next week's briefing via media advisory when a time and date are set.